Democrats are within their rights, certainly, to say these are immigrants that we're talking about that have legal status, but the counterclaim from JD Vance and company would be, we don't see them as legal immigrants.
Welcome to The Debrief, where we talk with the Washington Examiner's top journalists about the headlines they're covering and where the story's going next. I'm Sarah Bedford, and I'm here with policy editor Joe Lawler. Joe, as we're sitting here recording, it's day 2 of a government shutdown, and there's obviously been a messaging war going back and forth between Republicans and Democrats, casting blame. Seems to me, in the years that I've been covering shutdowns, it's one of the first times ever that the Republican messaging actually seems to be resonating in DC media. It's like the prevailing narrative and not just a Republican narrative. And part of that Republican messaging has involved accusing Democrats of forcing this shutdown in order to give health care to illegal immigrants. What is your vibe on that talking point? How accurate is it?
Yeah, you're absolutely right. I think that JD Vance in particular has done a good job of promoting this message that is the Democratic ask. And I think what it comes down to is, what is your definition of an illegal immigrant? That's a term that could be used in multiple ways. So the Democratic argument is illegal immigrants are barred by law from receiving any federal health care benefits. And the counterclaim from JD Vance and other Republicans is that that the law may bar all illegal immigrants, but there are categories of migrants who were given legal status by Joe Biden, they say illegally, who are receiving these benefits. So this came up in the vice presidential debate between JD Vance and Kamala Harris, if you'll think back that far, about when he was fact-checked on stage and JD Vance pushed back and he said, no, these were migrants who were led into the country by the Biden administration through the CBP1 app, and they should not be here illegally, and we don't accept them as legal immigrants. We don't view that status as a legal status. So I think that Democrats are within their rights, certainly, to say these are immigrants that we're talking about that have legal status, but the counterclaim from JD Vance and company would be, we don't see them as legal immigrants.
Some of the Democratic asks involve reopening loopholes, as Republicans would describe him, that the One Big Beautiful Bill closed when it comes to Medicaid eligibility and FMAP and all these technical things. Back when One Big Beautiful Bill was being debated, Democrats, they did have that chance to make the argument in favor of, not closing those loopholes. I mean, what do you see as the political, what do you make of the political tactic of just very recently, after the passage of that legislation, trying to relitigate that battle?
Sure. Of course, that was a huge bill, right, which implemented trillions of dollars in tax cuts. It did a lot of other things. It had border spending. It had military spending. One of the things it did was save costs for the federal government by barring some migrants from getting health care. And Democrats are looking to reverse, or asking to have all of those changes related to health care in the Big Beautiful Bill Act reversed. So I guess to put this in perspective, some numbers are helpful. The White House's claim is that the Democratic bill to reopen the government with all of these asks would be $1.5 trillion. The provisions related to illegal immigrants in the White House's reckoning is about $200 billion. So not even close to a majority of what we're talking about, just a relatively small piece of it. Of course, that's a big ask, right, to say, we want you, in order to have us vote to reopen the government, to repeal this bill you just passed. We haven't seen anything like that happen in recent history, for sure.
Another one of the Democratic asks right now, and when we're talking about a 7-week period of government funding, right? We're going to sort of have to do this all again right before Thanksgiving, which is just great timing. Washington loves that. The other ask that they have is extending Affordable Care Act subsidies that are going to expire at the end of the calendar year. And that didn't line up with the fiscal year deadline, so Democrats didn't necessarily have all the leverage that they would have otherwise. Do you think that that is a more reasonable or realistic ask from Democrats, and something they might end up getting?
Yeah, I mean, that is an ask that we've already seen from some Republicans that they're willing to engage on. So to that extent, yeah, that seems like a much more reasonable chance of success for Democrats. Of course, what we're talking about are additional Obamacare premium subsidies beyond what was provided for in the law originally, that were enacted as a COVID emergency measure by Democrats. The talking point for Republicans has been that no Republican has ever voted for these subsidies. And now these additional subsidies. And now they're being asked to do that as the price of keeping the government open. So on that level of rhetoric, it's still kind of a big ask, but at least we've seen the initiative from Republicans to take that first step and have some members talk about doing that. And of course, Republicans don't want to be hit with the political problem of having a lot of people's Obamacare premiums rise right before the midterm elections, which is what would happen if these additional subsidies are not extended.
So maybe we'll be back here in 6 weeks or even next week talking about those extensions. Joe, thank you so much for being here today. You can get more from Joe and the rest of the policy team at washingtonexaminer.com.